Oh, this is always an interesting slide. It's been around for a long time from the CDC. In Atlanta, they put this out. What are the determinants of health? It's fascinating. Behavior, which is why we're talking so much about behavior in consumer-driven healthcare products and in healthcare consumerism. 50% of the determinant of health is from behavior. Access to care, 10%. Genetics, 20%. Your environment, 20%. General numbers. I would say, in your urban areas, I would suspect that environment is a big issue around healthcare. If you don't have good safety, police, lights, fresh fruits, foods. So this obviously changes a lot by your geography, but that's pretty impressive information that the reason why we're focusing on behaviors is because on average it is 50% of the determinant of your health and healthcare costs. From the Institute of Medicine, here's their top 20 priorities nationally. So you might want to take a look at your own claims data and see how you match up with these areas. Typically the highest cost, if you take a look at your 5 highest costs, they're usually around asthma, congestive heart failure, diabetes, musculoskeletal issues. Those are some of the areas you'll find, and you'll see some of those programs identified here as high priority from a national perspective. If you don't do your disease management or your condition management programs right, again, a little bit of a average actuarial analysis. There are various types of programs. You can put something in that's pretty passive, that you're not really requiring or incentivizing your employees. You can put something in that's fairly assertive and aggressive. 3 categories I list out here. And you'll get different participations in those programs, and you get different levels of savings. Just as a thought. So again, I recognize most people could jump into an aggressive category, but as you work your way through, there are additional potential incentives and savings that should come with a plan. This is what healthcare consumerism is all about. We're already getting a lot of active consumers out there. I mean, people are much more aware just because of all the healthcare issues that this country's been facing for a long time. They're asking about these things. They're searching on the internet. They're asking their physicians. Genetic testing. Everybody heard of 123andMe? You can actually spit parties. You get a test tube, you sit around, you spit into it, you send it off to 123andMe, and they'll send you back a genetic profile of what your propensity is for heart attack or diabetes or cancer. It doesn't say you're going to get those, but that you have a higher or lower propensity. So traditional underwriting doesn't make any sense. So getting rid of it under ACA, I think, is actually a pretty good deal as somebody who came up through the underwriting ranks. Because now the consumer can anti-select against the insurance company. You do that test, find out what your propensities are, and get coverage for those things to protect yourself more. It's not like having a pre-existing condition, but if your propensities are there, you're more likely to want to get the insurance protection. So we're already seeing, I thought this was interesting here. My old firm, PricewaterhouseCoopers, did a study and found that nearly 1/3 of consumers had used some sort of social media for healthcare. So people are trying to connect out there again in various ways. And so I describe this as the self-absorbed me generation, of which I'm a part of, is giving way to those sharing communities on Facebook, on Picasa, LinkedIn, Plaxo, YouTube. We're sharing more in these areas. And it's becoming, that internet community out there. You take a look in your community and you get the data. Somebody mentioned earlier there's Health Shares, Sabimo, Health Grades that give some data on hospitals, for example, and the quality. You will be shocked, absolutely shocked at the difference in the cost and the quality of the providers in your community. You will be equally shocked by those hospitals that have a brand name that you think are the best hospitals. When you put numbers up, they ain't always the best hospitals. Now, they'll all claim that they got the sickest patients. That's why. But the numbers on any of those services are risk adjusted. So they're supposed to be normalized. Risk adjusters in actuality, I tell you, are not perfect. They're best 30% accurate. But in any case, they do some risk adjusting there. And it's really valuable information, especially if you're negotiating. Insurance companies use this information to negotiate with many of the hospitals out there. Say, hey, you're not so great. I need a lower price if I'm going to send people to you. You need to improve your quality. Some of the quality officers in the hospitals use that information to try to improve the quality of the hospital. So it's an internal thing, but you don't always know that. It's not easy to get to, but it's out there. It ought to be required and mandated by law. If I was king of the day, I'd make people disclose that information or lose their protection. And I don't know how many people know what a CON is. Anybody know what CON is? Certificate of Need. So you're protected. Nobody can build a hospital around you. So you got the protection of law in most states. It's been coming down, getting weakened at times. But if you're not going to provide information and disclose information to the consumer, because they have a right to know, then you should lose your certificate of need and let a competitor come in there who will provide that information.